Pleasure to serve youth and families. We're here to answer any questions you may have. Hopefully I answered a few of them along the way, and here for you. My team is here.
Thank you very much, and thank you for what you do. Senator Neal, did you have a question?
Yes, thank you, Madam Chair. So I had a question on the Clark County, it's the child welfare grant elimination. Is that under you?
I'm not aware of a Clark County Child Welfare Grant elimination. Perhaps we can get a little more information and get back to you.
Okay, so, yeah,
Absolutely.
all right, thanks.
Assemblywoman Anderson.
Thank you, and thank you for the presentation. As I've already brought up about the mental hospitals being closed for our youth especially, so it sounds like it's because of the staffing issue. So with that, I'm going to actually borrow a question from my my colleague. What are the requirements for these staffing? Because it sounds like this is something that is a little bit more than just, hey, you're breathing, come on in and get hired. So what are those staffing mechanisms? Is that consistent across the nation at this time?
Thank you. For the record, Cindy Pitlock, through you, Chair, to you, Assemblywoman Anderson. Let me give you just a brief stab at it, or, actually, I think I'll turn it over to Dr. Wade, who is over the direct clinical services, and she would probably be able to be a little more articulate.
Dr. Jacqueline Wade for the record, Madam Chair and committee members. A lot of these positions are specialized positions. As we noticed through COVID, we did have a shortage of nurses because they went to the medical hospitals or they were sought after in the medical hospitals. So we had difficulty recruiting nurses. Other specializations happen to be clinical social workers and other mental health professionals that are licensed. And so we are having difficulty recruiting specialized personnel for these hospital positions. So this is why we're seeing some shortages in these specialized positions.
Thank you. Follow-up, Chair?
Yes, go ahead, please.
Thank you. So it sounds like the number one reason is, what is the largest barrier then, besides the fact that it's the specialized positions? Is it pay? Is it benefits? Is it expectations of job? What is the largest issue, in your opinion?
Chair Cindy Pitlock, for the record, through you to Assemblywoman Anderson. I do think it is a pay issue at the state level, but there are also some other challenges. Working with youth with behavioral disabilities is a very specialized type service. The acuity level is very high. It requires people that really want to work well with youth that have behavioral health challenges, and particularly at the level of the behavioral health technicians, we pour a lot of training into those people in order to be able to respond to these youth appropriately. We have handle with care training specifically to learn hands-off interventions for de-escalation. That is a challenge to find. It's such a niche or niche, depending on which area of the country you're in, right? It really is. It is a very specialized thing, but I think also in general through our state system, we tend to lose a lot of people that we're trying to onboard because it just takes so long to get from here to there. But I know that we're all working together. We're working with Durham. We're working with the director's office, everybody we can to streamline those processes. So I really think if we can bring forward several solutions, we can get there.
Thank you. And then I do have my last question, I promise.
Sure.
Thank you. Thank you for the time. This is a question from slide number 10. You mentioned the mobile crisis response for the 2 large school districts. But what about the other school districts? Has there been any outreach and or any other communications with our other school districts? And please consider the charter schools as well. Although they are part of those school districts, sometimes they're not always contacted. So just wondering if there's been any contact outside of the 2 largest school districts.
Great question. Dr. Pitlock, through chair to you, Assemblywoman Anderson. So the ARPA funding that we received specifically for building out Clark and Washoe School District response, we're partnering with Department of Education and Clark and Washoe County School Districts for that response. The Rural Mobile Crisis Response Team is actually under Division of Public and Behavioral Health. Because of the remoteness of all of rural Nevada, right? A lot of their efforts are coordinated via telehealth and also with local community providers. So I know that DPBH is working hard to also make sure that the responses to the schools are appropriate, and they would probably be able to answer the question in detail a little bit more than I would. You're welcome.
Thank you very much. Assemblywoman Backus.
Thank you, Madam Chair. I have two different questions, but I'll ask the first, then ask the chair if I can ask my second one. My question pertains to slide number 6, the agency challenges, mainly Department of Justice audit that you were talking about from October of 2022. I had pulled that up, but it seemed like and I may be incorrect, and feel free to correct me, but it looked like from what the agency was requesting in monetary needs was much higher than what was provided in the governor's budget. And so I was curious how that may impact the state's ability to comply with that audit, especially when the conclusion of that audit provided that some threats that the federal government may take, including a lawsuit against our state for failure to comply. Can you just kind of elaborate on that? Maybe I missed it, may have been shifted into another budget category. Thank you.
Dr. Pitlock, through you, Chair, to you, Assemblywoman. So the Department of Justice response is really across all of DHHS, and all of us are involved in creating that response and sprinkled throughout all of our budgets, and including build out for sustainability of new programs that we're standing up through Medicaid. I would say that we were so pleased with the ARPA funding to really get us kicked off to stand up that community-based service array, and all of us together are working towards sustainability. So it's not just one piece or one person or one program that's going to solve the problem. It's really across divisions. I think that right now, based on what we're trying to build out, we're pretty well aligned in our response with the Department of Justice, but it is a little too early to tell. We also need to be collecting data along the way to make sure that these new programs we're standing up are really landing the successes that we think that we're landing. But if you look at the DOJ's really big highlight is deinstitutionalization of youth, and youth that need to be institutionalized for acute stabilization need to be there for the shortest amount of time. And there's a huge focus right now on building out that community-based service array.
Thank you. I'm a CAP attorney for some of my pro bono work, so I truly appreciate that, because I've had clients who have been subjected to long-term stays and then just almost become institutionalized when they turn 18, so I appreciate that. Madam Chair, may I ask you a second question? And my second question for you, and I may have misheard you when you were reading it, you were talking about that there are 73 youth that were currently placed out of state last year, and that there was a need for, we just don't have the resources to provide for those who are juvenile sex offenders, and also those on the high autism spectrum. Do you kind of have an idea of what the percentage of those that really do need to go out of state are out of that 73?
Dr. Pitlock, for the record, through you, Chair, to you, Assemblywoman, that's a really good question. I think that's where our data needs to really show us what our ongoing need is, because remember earlier in my presentation we talked about transition back to home and community, right? Well, if there's nowhere to transition an out-of-state youth to for wraparound services in home and family, how do we shorten that stay? Do I know how many inevitably really need to be placed out of state? I don't know. I do know that we can reduce that number by keeping youth in Nevada, and in order to do that, we need to have the right level of services for the appropriate amount of time with the right step down and wrapping of services. but some services just aren't available here right now, like the juvenile sex offender type program. But even for that type of a program, when we do send a youth for specialized services, we need to be keeping that eagle eye on how long the youth is there and starting discharge planning. We always start, as clinicians in the room will tell you, we start discharge planning before admission, or at least at admission. So I'm not sure I can give you a specific number.
Thank you, and I appreciate what you guys do. Thank you.
Thank you very much. Vice Chair Monroe Moreno.
Thank you, Madam Chair. I'd like to go back to the question that Senator Neal had asked about the Clark County Child Welfare Grant elimination. In our backup documents, it appears that the governor is recommending a reduction of $8.8 million in federal certainty grant funds in each year of the biennium that would go to Clark County Child Welfare. Is that because the federal grant has come to an end? Are they pulling back the funding?
Dr. Pitlock, Chair, to you, Assemblywoman, I absolutely don't have an answer, but I'm going to get one.
Thank you, because further down, it appears that there's federal grant money that we will not be getting for Washoe County, but in the back language or documents that we have, there's an ask to replace that with general fund money, but there wasn't an ask for the Clark County money. So if you could get that, that'd be great.
Thank you very much. Additional questions, committee? Senator Gokachia, please.
Thank you, Madam Chair. And I just need a little clarification on, we're cutting the Kellyana Youth Center, 32 beds, it looks like. NYTC, you're going to increase that with the female beds to what number?
Thank you, Cindy Pitlock, through you, Chair, to you, Senator. We're going to start, there's eight female youth there now, and by the end of the fiscal year, we anticipate 16.
Thank you, Madam Chair.
Any additional questions? I have just one. When you were talking about you didn't have staff in the facility for the little people, and you had to move those children, where are those children moved? And we moved the children, I mean, obviously not the staff.
Dr. Pitlock, to you, Chair, through you, to you. So at the time, we had a skeleton staff doing the best we could with what we had, with 3 littles at PRTF Enterprise. We moved those 3 littles to PRTF North, and what staff we had with them to PRTF North. It's not our intent to keep them there. Hopefully, we can reinvigorate PRTF Enterprise. There's 16 beds there that are empty. That's huge for the Northern Nevada community. That's a huge hit for Northern Nevada, and we are, even as we speak, working as hard as we can to find staff that is appropriate for that facility, so we can get any bed. If I could get 1 bed, I'll take 1 bed. Give me 1 bed. Give me 2, I'll take it. I will open it, and I will open the doors for even 1.
And is this staffing issue not able to find trained staff, not having the money to pay that staff, add all those things in there? Is it what is the biggest issue with finding staff? Is it just that we don't have enough trained people now, or is it that we don't pay them enough so they don't come to us?
Boy, that's a tough question. Dr. Pitlock, through you, to you, through you. I think there are a lot of nurses out there that really can get a better rate somewhere else, or can go to a county or through a staffing agency, or work in a locums position and really do quite well for themselves. And that's really frustrating for us. I understand why one would want to do that. But, the state's a great place to work, and we have great programs. And I think pay really is really the biggest thing. And specialized workforce as well.
Okay, thank you very much.
You're welcome.
All right, any additional questions? Dr. Titus, or Senator Titus?
That's all good, thank you. I appreciate the jumping in, allowing me to jump in here, Madam Chair, but it just raised some other thought. I understand the pay, and during the pandemic, a lot of the nurses, and certainly in my local hospital, chose to be travelers because they could make 3 times as much and just move on with that. But is there, so yes, and that's across all boards in the state, regardless of what the occupation is, what department, we have staffing issues, and we recognize they don't get paid enough compared to the private sector or other municipalities. Is there, you mentioned the specialty staff, and one of my concerns is that we have too many obstacles for occupational licensure in the state of Nevada. And I'm wondering if there's any reciprocity in some of those other fields, not just, we've tried to get nursing reciprocity here in the state, we've tried to get other reciprocity in the state. I'm just wondering, is it also a question that there's people who will come here if they could get their license here?
Dr. Pitlock, through you to you, Senator Titus. Yeah, I do think that would make a difference, especially for licensed professionals. We do also have a really hard time recruiting mental health techs. A salary starts at $17 an hour, but I saw this ad that you could go to Target and it's $24 an hour and not get punched in the face and thrown to the ground by a kid that has a violent outburst, So I think it's a combination of things, but I certainly am in favor of any barriers that we can reduce to get licensed professionals to move freely about the cabin, I guess. So, yeah.
Great, thank you, and thank you, Madam Chair, for the question.
Okay, Assemblyman Miller.
I'm sorry, I just have one quick question. Thank you, Chair. And this is really probably more of a Health and Human Services Department-wide question. But when we talk about the specialized roles that we need to fill, I'm just curious, are we finding less people are going into those fields as well? Is that an issue? And it may be different from department to department based on needs. But I'm just curious if there is an issue with people actually deciding to choose the fields, the roles that we need as a career choice.
Dr. Pitlock, through you, Chair, to you, Assemblyman Miller. Perhaps. I think that we across divisions are making concerted efforts to partner with the universities to enhance their programs. I can tell you as a clinician, it's extremely challenging to find clinical sites. And that can be quite discouraging for students. Do I know or have the data of, is there enough coming in for enough of an output? Probably a better question for NCHE or one of the Department of Ed type programs. But I can call out clinical sites as being extremely challenging to find.
Any additional last call? All righty. Okay, thank you so much, and thank you for all you do for our youth. All righty, we are now on to Aging and Disabilities Services Division. This will be our last presentation of the day. And Administrator Dina Schmidt is here to give the budget presentation. And so when you get yourself ready and settled, please feel free to start.
Thank you, Madam Chair and members of the committee. My name is Dina Schmidt, and I serve as the Administrator for Aging and Disability Services, and to your benefit, I'm probably the fastest talker of all of us, so I'll try to make this easy on you. To my right is Ricky Robb, our Deputy Administrator over Children's Services. To my left is Tiffany Lewis, our ASO, and to her left is Jessica Adams, our Deputy Administrator over Developmental Services. Going right into the presentation on slide 2, you'll see our mission and vision statement. And moving on to slide 3 is our organizational chart. Beginning on slide 4 is a summary of our operations, including advocacy. ADSD plays a unique role in the fact that we both advocate and provide direct services. Some of our advocacy role just includes Adult Protective Services, the Office of Consumer Health Assistance, our advocacy attorney, and our long-term care ombudsman program. We also have children's services, including early intervention services and autism treatment assistance. Our developmental services program, you'll hear a lot more about those later on in the presentation. Our Office of Community Living, which is a complex array of services aimed at keeping individuals with disabilities as well as older adults in their home and in their community, and you'll hear more about those as well. And then there's our quality assurance and administrative. Moving to slide 5. Some accomplishments that we would like to highlight for you. Our Adult Protective Services now has an online reporting tool, so individuals can report in substance or abuse, neglect occurrences 24 hours a day, 7 days a week, which is new to us, and we're very excited, especially a lot of our hospital facilities, and has really appreciated the ability to do it online. Over the last couple of years, we have been working with the University of Nevada, Reno, their School of Social Work. We have developed a curriculum aimed at getting more social workers ready for the field of geriatrics. That has been exciting work, and we've seen some successes in transitioning and recruiting social workers out of that program. In our autism treatment assistance program, we're excited to tell that we're serving more children than ever, and that we have reduced our average wait times for services substantially. In our quality assurance unit, we kind of play a dual role here. We have oversight over quality improvement, but we also have oversight where we try to do technical assistance. So we've been able, through COVID, to bring a lot of training to our provider network to try to help them with improving the quality of their services. So that's been an exciting opportunity. And then just 2 federal grants that we've received, one related to no wrong door governance, really working across the department. As Robert mentioned earlier, he has the data system to try to do the no wrong door efforts, but we're really looking at the governance so that we're all working together going forward on what a true no wrong door looks like. We're excited about that opportunity. And respite services. This is a huge gap that we've identified, especially for those children with dual diagnosis, and for parents of children with disabilities. The respite services that are available to them are so limited. So these 2 federal grants are both aimed at trying to address those issues. So we hope to be able to report out successes in those programs going forward. Moving on to slide 6 is our agency updates. Vacancy rates, you've heard them all today. I won't repeat them. I won't read them to you. Same idea. We're all struggling, but just wanted to call out some high levels there for you. Our Office of Community Living highlighted this just because it is a holistic approach. We've, during the interim, we were approved an agency manager position, so we have combined our community-based care and our planning and advocacy groups. And really, these groups are now working together, really looking at how do we enhance access to our services, making sure that individuals receive the right service at the right time, so that folks that do come to us, they may not be eligible for the service they applied for, but we're making sure they get connected to anything else that they are eligible for. And then our elders count. This is a biannual report that we put out that provides comprehensive data on Nevada older adults. The draft report will be posted this week. We try to make sure this is available for legislators as we go forward. Gives you a comprehensive look at what the challenges faced for the elder populations in Nevada are. And we are embarking again on our Olmstead planning updates. We just like to highlight that. There are some links here. You can get more information regarding the process. We are looking for as much community input as possible. On that website, you can get meeting notes, meeting dates, and you can also provide input into the service gaps for yourself or anybody you know. So would encourage anybody to share those links as far and wide as possible. Moving on to slide 7, it starts with our division priorities. These are the 4 areas you'll see focus on: infrastructure, Our agency has grown substantially over the last few bienniums, but we are, as you'll learn later, heavily based on caseload, and so we're really looking for HR, IT, and fiscal support. Maintaining positions we received through the COVID pandemic, and then reclassification and equity adjustments, and as Director Whitley and others have mentioned, provider rates. Slide 8 shows our budget by funding source. You can see a little bit of growth since the previous biennium. So moving on to slides 12 through 24, and I'll go through each one, but these are really our caseload projections for each of our programs. As I mentioned, the majority of our budget is built on caseload and driven by caseload. Slide 9 is our family preservation program. This provides financial assistance on a monthly basis to low-income families residing in Nevada who are providing care for their family members in their home with a profound or severe intellectual disability. And slides 10, 11, and 12 are the caseloads for our developmental services. Developmental services program provides services to individuals with intellectual and developmental disabilities. We currently serve over 7,600 Nevadans get services through 3 regional centers. So there's the Sierra Regional Center that serves Washoe County, Desert Regional that serves Clark County, and Rural Regional that serves all remaining counties in Nevada. And so you can see those on slides 10, 11, and 12. Slide 13 illustrates our early intervention services. These are services provided to children aged birth to 3 who have a known or suspected developmental disability or delays in their areas of cognition, communication, physical development, including their vision and hearing, social and emotional development, and/or adaptive skills. Slide 14 illustrates the need for our autism treatment assistance program. This program assists parents and caregivers with the cost of providing evidence-based treatment to their children with autism spectrum disorder. We fund the treatment programs. We are not direct service providers in this program. Moving on to slide 15, our personal assistance services. This program funds community-based in-home services that enable older adults and persons with severe disabilities to remain in their home and avoid placement in a long-term care facility. Our community options program for the elderly is on slide 16, similar program that supports services to those 65 and older, also aimed at keeping them in their home and independent as long as possible and avoiding institutional care. Slide 17 displays our long-term care ombudsman program. This group of folks investigate and resolve complaints made on behalf of individuals residing in long-term care facilities. They advocate for residents in protecting their health, safety, welfare, and rights. Slide 18 is our adult protective services. They investigate reports of abuse, neglect, exploitation, and self-neglect. They work to resolve the issues on behalf of vulnerable persons 18 to 59, as well as individuals age 60 and over. You can see a substantial increase. We did move from elder protective services to adult protective services back in 2019, and you can see that demand reflected here in this chart. Slide 19 is our Senior and Disability RX program. This program provides a Medicare Part D supplemental payment to assist with the cost of Part D plans for seniors and people with disabilities. Slide 20 is our home and community-based waiver for the frail elderly. This program also provides in-home services to assist those 65 and older to remain in their home. Services include case management, homemaker, things like adult daycare, adult companion, personal emergency, respite services, basically anything a person needs really to remain in their home and avoid institutionalization. And slide 21 is our home and community-based waiver for persons with physical disabilities, very similar program, variation in services, but also all aimed at maintaining independence for folks. Slide 22 outlines our facility population. ADSD does operate one 24-hour facility. This is our Desert Regional Center. It is an intermediate care facility. This is a licensed facility that provides services to individuals with intellectual disabilities, including active habilitation treatment to promote functional skills and increased independence. Slide 23 is our biannual budget account by summary. I will point out on that slide that we do have 4 new budget accounts that we'll be talking about as we move through the session. Those were created just really for increased transparency and efficiency. Some of our budget accounts got way too big, and so there was a need to break those out. On slide 24 is a summary of our major enhancements. First is our administrative infrastructure. These are requests for positions to support the growth of the division. As I mentioned earlier, over the last 3 bienniums, our HR, IT, and fiscal teams have not grown, but the size of our agency has grown substantially. And the program administration positions that you see here, these are really related to supporting the growth of the complex needs for the people we serve. We're seeing, like other agencies have mentioned, individuals with more and more complex needs, and so really a need for some specialty services and specialty positions to help us develop plans for those folks and make sure that we're addressing their needs. The third one on this slide is our social work reclassification. This is really a request to upgrade 48 social worker 2 positions to 3s and 9 social work supervisor 1s to 2s. The purpose of this is to align our social workers in protective services with those in child protective services. On slide 5, you'll see a continuation. The first one there is a 2-grade increase for our developmental support technicians. These are the team members at our intermediate care facility that provide direct support to individuals residing at the intermediate care facility. As mentioned earlier, our current, these are some of the lowest paid positions in our state agency, and we often have people join us, stay a day, stay a week, and then leave us because it's a difficult job. Most of the people that do it because they love it and they care deeply. But they can't sustain a living working for us at this time. So really, we are looking at increasing the rate of this entry-level position by 2 grades in hopes that that will help us recruit and retain folks to serve. The other thing to think about this one is it really does put us at risk for staffing ratios. This is a licensed facility, and we are required to maintain staffing ratios. And we, like everybody else mentioned, we're facing those same challenges every day, and the overtime that we're paying becomes a concern. Second one on this slide is a continuation of existing positions that we received. During the interim, we received a lot of Older Americans Act ARPA funds into our agencies, and we recreated some positions during the interim finance committees with those funds. And then since then, we've been approved for more ARPA projects through the state ARPA funding, and so this is just a continuation of those programs to ensure that we can enact all those new programs that we were giving funding for. You'll see several rate increases across our array of services, our community option program for the elderly, personal assistance services, family preservation services, developmental services, fiscal intermediary program, and our early intervention program. So there are rate increases requests throughout our budget for all of those programs. And for all the same reasons that you've heard all day today, I won't repeat them. Slide 26 is just a position summary, shows the number of FTEs. You do see one large decrease there that, just so you know, is a transfer. It's not actually a loss of positions, it's a transfer of positions to those new budget accounts that we discussed. Slide 27 is the 2 bill draft requests that we are putting forward. SB 43 is really just a kind of a cleanup bill that allows our Commission on Aging to a change that's needed to help fill long-term vacancies for representing counties and city governments. The current language really limited who could participate, and so we're just hoping this will increase our participation in our Commission on Aging. SB 4 improves access to prescription drugs. So our Senior Disability RX program has a small limitation on the funding. We cannot direct fund service, or we have to direct fund services. We can't subgrant it. We're one of the few FHN programs that doesn't subgrant. And so we're asking for flexibility to do that so that we can expand those services and meet the needs of more people. So, like I said, I think I was pretty fast. I did provide contact information, and I just wanted to also point out that we did include in Appendix A. A lot of our programs that we don't have caseloads for are very complex, and there's a lot more programs that we oversee and provide than people realize. So in the appendix, there's a lot more detail for you regarding some of those programs within our operations. So with that, I'm happy to take any questions.
Thank you very much for that presentation. I believe Assemblywoman Brown May has a question.
Thank you, Madam Chair. I do have a couple. So there's some line items here that address wait lists for several of the services that the division provides. I'm curious to know, with the increased rates and funding to cover the wait list, are you confident that the funding will cover all of the people on the wait list, or are we only going to address certain parts of a wait list, perhaps acuity?
Dina Schmidt, Madam Chair, through you to Assemblywoman Brown May. Every session, we're asked if this is enough money to address the wait list. And honestly, I mean, I don't believe that we will ever address wait lists because of the growing demand for services. But secondly, ourselves, as well as our providers, as you well know, are struggling to onboard staff. So by the time the funding hits and everybody can onboard staff and get them trained and start to serve people, attrition will take time to get to that wait list. So will this address the wait list by the next biennium? I would not want to promise that.
Thank you, I appreciate that clarity. So that leads me to my second question, if I may, Madam Chair. We have received a Department of Justice investigation with regard to child and family services, stating that we don't provide adequate services for that group. Are we then at risk for a similar investigation for how we're providing services through aging and disability services, or do you feel like we have enough, and feeling is not the right statement, do we have adequate providers available in the community to stay another Department of Justice investigation?
Dina Schmidt, for the record, Madam Chair, through you to Assemblywoman Brown May. So I can't speak on behalf of the DOJ. That really is under investigation, and I am not intimately involved and can't speak on behalf of that. What I can speak to is, do we have enough providers? No. Do we have enough specialty providers? Absolutely not at this time. That is why we went before you for the Interim Finance Committee to get ARPA funds to try to bring in specialty providers. So we received a rather large allotment of money that will be going out to request for proposal to try to recruit providers who can serve the dual diagnosed individuals. So those are those folks with intellectual and developmental disabilities as well as behaviorally. So they're really behaviorally complex. Those are the folks that we're having the highest challenge. That's one thing we're doing. The second initiative that we have is, as we've done we had a rate increase completed by a third party last year. And what they did was help us establish tiered rate system, so that our current rate structure is just set that every provider gets the same rate for every person depending on the service. So this tiered rate will allow us to pay higher rates for the more complex individuals. So we're hopeful that some of our providers will be able to take on more folks because they'll be reimbursed accordingly for those higher need individuals that may take 2-to-1, 3-to-1. So those are two of the major initiatives that you'll see in our budget going forward to try to address the needs there. So I hope that answers your question.
Thank you, it does. One final question, if I may, Madam Chair. Thank you. I just want to clarify, one of the positions that you talked about in your report is the developmental support technician, right? Which is at the Intermediate Care Facility, Desert Regional Center currently. Does that correlate to personal care attendants that we're hearing about, or are they two completely different positions?
Dina Schmidt, for the record, Madam Chair, to you, through you, to Assemblywoman, they're not related. I could pull data to give you the income levels to compare the two. But I know that the personal care agency rate increase that Medicaid put forward was $25 an hour. The positions that we start with are much lower than that, but I can provide that to you as a follow-up if you'd like.
Thank you. Thank you, Madam Chair.
Thank you very much. I believe Senator Neal has a question.
Thank you, Madam Chair. So I had a question on slide 19. So I was just trying to figure out, because I see the GovRec and then the ledge approved, and they're pretty much the same. Well, the ledge approved is higher, but I wanted to know what's the demographics of the seniors that access this program, and then what is truly the effect of this reduction on that population?
Dina Schmidt, for the record, Madam Chair, through you to Senator Neal. Great question. So the Senior and Disability RX program has, the demographics are two populations. One are individuals on Medicare who are on disability, or seniors on Medicare. So the program currently subsidizes Medicare Part D payments. So when you're on Medicare Part D, you pay a monthly premium. Let's just say it's $50. We supplement $37 of that $50. Over time, because of the donut hole, this program has changed substantially, and the demand for services has gone down each year. So we're really, we mentioned a BDR. One of the things that we're looking at, because of this exact graph, right? We thought that the demand would go up, and it has not. It has continued to drop off year over year. And so that's what we have been looking at, is trying to figure out, what does this program need to look like in the future? Because its old version doesn't match the need of the community. The need of the community is related to copays and deductibles, to be honest. That's where people are having high out-of-pocket expenses. It's not their Part D plans that are expensive anymore. It's their copays and deductibles they need help with. We would like to switch to something like a voucher program where many of our community partners have voucher programs where individuals with high copays for, let's say, one specialty drug, they can go get a voucher that helps offset that cost. And so that's what our BDR is meant to do, is to change the way we can fund so that we can establish a new program that meets the demands and the needs. Because as you can see, projected the way we currently do this, we're not projecting to increase demand and serve more people. So we'd like to switch the program up and actually meet the demand that's out there.
Thank you, Madam Chair. So, okay, I get that you want to, I guess, reorganize the program, but the existing it's $37 that operates in the gap. What will you do with the accrual of those funds in order to flip it to a copay? And how many can you actually service within a copay model, right? I mean, because I just keep thinking, the older person is and using the Medicare D, they typically do still need some prescription coverage. So I'm wondering, just explain to me how prescription coverage will continue to be managed, and if it's lost, and if it's around a copay, which could be the $1,200 or however many dollars they have to pay over a year. Talk about how you plan on, I guess, redistributing that cost, and how many seniors will actually be eligible under a remodel.
Dina Schmidt for the record. So those folks that are now receiving the $37, we would stop paying that at some point, right? We would give them appropriate notice and stop paying the $37, but they would still be eligible potentially for the program to switch from paying a part of their Part D plan to actually helping them pay their copay. So the voucher program would be open to more individuals than just Medicare. It could be individuals with other health plans that don't provide adequate prescription drug coverage. So it would expand the number of people that we could serve. I don't have projections yet. That's something we're waiting to see if the BDR passes. We will start to work on that and create projections for the next biennium on the numbers that we could serve. But it really just switches from supplementing a Part D only to supplementing anybody's needs for prescriptions. So if somebody, that $1,200 a year, they can only cover $600, we might be able to cover up to $600, which is substantially more than that $37 a month that we're covering now. I hope that helps.
Okay, and I promise you this is my last question, but okay, so in this world of theory where you're saying it could be 600, but the gov rec is way lower than the ledge. So how are you going to sustain, I guess, the theory, right? Because you're going to build your numbers if and when the bill passes. So your population or your caseload is kind of, I would say it's limited because you're operating, you should know what your caseload is so that when you craft the bill, you know exactly what the appropriation is that you need, right, for the biennium. Isn't it? It's kind of like the cart before the horse, the chicken before the egg. I don't know, but I know there's an egg because for the chicken.
But how much is that egg these days?
Dina Schmidt for the record. Madam Chair, through you to Senator Neal. Thank you for the question. I think I understand now. I apologize. I think I misunderstood your question. So as we transition the program, what we anticipate is we will run out of money before the next biennium, right? We will start a wait list because we don't know. What we'll do originally is take the population that we serve now, realize how much money we have, right, and provide a voucher system to those individuals to support them through the biennium. But we will also allow people to apply for the program whether we have funding or not, and we would create a wait list. So by the next biennium, we would actually have the data to show that demand. There's no way for us to figure out what that demand is today without actually allowing people to apply for the service. So our hope would be that we would continue to serve those that are on the program in a better manner, but then also collect the data to show the demand going forward and come back in the next biennium with a request to increase the program.
Thank you, Madam Chair.
Thank you very much. I believe Vice Chair Monroe Moreno has a question.
Thank you, Madam Chair. Yes, I do. It's on slide 5 of your presentation, and it's the partnership with UNR School of Social Work. And I may have missed it, and if I did, I apologize. How many students are currently in that program that you're partnering with? And do you have any plans to expand that to other institutions within the state?
Dina Schmidt, for the record, Madam Chair, through you. So a couple different things. One of the things we did was we helped them, they allowed us, which was a wonderful partnership, to help them develop curriculum. What we were seeing is social workers coming out without adequate skills to work with our populations. And so we were involved in creating and changing their current curriculum, which was huge. They also, in addition to that, provided in-person training and created a staffing curriculum and a certification program for our staff. So all of our staff went through their program. All of our social workers were allowed the opportunity to go through a 2-day, I think it was 2-day or 4-day class where they received a certification. And so that was helpful to all of our team members. And then in addition to that, we are working with them on internships. I don't have the number of interns or students in that program right now, but I can certainly get that for you as a follow-up.
And do you have any plans to expand it to other educational institutions within the state?
Dina Schmidt, for the record, I apologize, I missed that part. Yes, we are always working with all of the schools. We've been in contact with UNLV. We are working with the community College of Southern Nevada, not on social workers, but on other areas for workforce development as well.
Okay, any additional questions? Senator Gansert, please.
Thank you, Madam Chair. We're hard to see down here. In an earlier presentation, there was a note about a cut to the autism rates, and I think it was 1.4 million, something like that, general fund, 4.1 million with the match. I just wanted, you had a chart there on autism, and I wanted to know what the percent decrease that was in the rate and how you thought it would affect services. Thank you.
Dina Schmidt, for the record. Madam Chair, through you to Senator Gansert, I hate to talk on behalf of my colleagues at Medicaid. So the autism rate is set by the Medicaid division, and that is a reduction in the rate on their behalf. So yeah. Would you like her to come up? Because I don't want to speak out.
That
I don't
would
want
be
to
great.
speak on
I just
behalf
saw
of a
you had the
sister agency. I
autism.
apologize.
You had the autism chart, so I thought you maybe knew that. Yes, thank you.
Chair, committee member Stacey Weeks for the record. Yes, the ABA, there are some adjustments to the rate, so there are some, it's not actually one rate, it's several services we are looking at and adjusting the rates. Some go up, some go down based on national averages and adjusting for costs. So we can follow up with the committee with a list of those services and those adjustments, but they were based on our quadrennial rate review process.
Thank you. And then in addition to that, how you expect that will affect services for those who are using them. Thank you.
Yes, thank you.
Thank you very much. And I would just add, I appreciate that the Autism Assistance Program has, I guess, shortened the time and lessened the amount of student or children, and I hope that we can continue to work on that as well. I believe that Assemblywoman Gorlow has a question.
Thank you so much. I'm going off of slide 7 where it talks about the provider rates and that a third-party rate study was conducted for the increases. Were the increases were they matched what those third-party recommendations were, or did we have to decrease some of them? How did that end up going through the wash? Thanks.
Dina Schmidt, for the record. So just, yes, we actually did align these with the actual rate study. Both the early intervention services was one that had a third party, and what's in the governor's recommended budget is aligned with that rate study. The developmental services rate study also is in alignment with what you see here, with a little bit of a tweak, because that one was conducted and finished maybe I think a year ago before some of the economic changes have had. So they did go back and rebase it based on current expenditures and cost analysis of within the business world. So that one has been rebased. So the study looks a little different, but we do have rebased information from the third-party vendor that this is based on.
All right. Any additional questions from anyone? Okay. It looks perhaps like we have just run out of steam or something. I don't know what.
Thank you, Madam Chair. The benefit of going last.
And once again, I would like to say to all of you, thank you for giving up your day and spending it with us and preparing all these documents and all the hard work you do for the citizens in Nevada. I know that sometimes it probably feels like it's not appreciated, but it is. So thank you. All right, with that, we will move to our last agenda item of the day, public comment. This is going to be the second and last period of public comment on the agenda. As a reminder, due to time considerations, each person will be limited to not more than 2 minutes. Please remember to state and spell your name for the record and then begin your statement. To call in to provide testimony, dial 669-900-6833, and when prompted, provide the meeting ID 854-3818-1804 and press pound. When prompted for a participant ID, press pound. The call-in information is also provided on today's agenda, and I'll begin with public comment from here in Carson City. Please go ahead.
Madam Chair, members of the committee, thank you very much. For the record, Carter Bundy with AFSCME. We do want to thank DHHS. We represent members throughout the state in different facilities and different divisions, and we certainly believe very strongly in the mission. We did have one concern that we hope to be able to be a partner with the administration on, and that's the outsourcing of the psychiatric residential treatment facility here in Reno. Obviously, they perform very important services, and it's a staffing issue. I think Director Whitley at the top of the day mentioned how difficult it is to get people in. We would love to partner with the administration to shorten the hiring time. And the truth is, if we can get a private company to hire people to do this work, there's no reason that the state, with PERS and everything else, shouldn't be able to hire them as well. I know this is something that probably will come up in our negotiations as well with the administration, but we think this is definitely a service that is best handled in the public sector. I think most of you know my home is actually in New Mexico, and I can tell you that when mental health services were widely outsourced during the previous administration, it turned out to be a total train wreck, because if they can't make money or it's not profitable enough even for a nonprofit, to stay afloat, they can pack up and walk away. The state doesn't walk away and shouldn't walk away, so we hope that with the legislature and the administration, we can find a way to keep that in the public sector. Thank you.
Thank you very much. Please go ahead when you're ready.
Thank you, Madam Chair, and good afternoon. I'm Connie McMullen, and I represent the Personal Care Association of Nevada. I'd like to thank you for all your time today, and certainly the state for putting together this wonderful budget. We are so much in favor. We've been advocating for over 20 years for this increase in the reimbursement rate for personal care services in our state. As you know, the caregivers were really in a crisis situation because we cannot find them. People just do not want to go back to work, and we've had a couple agencies up here in the north actually close for that reason. We heard some great testimony today about reimbursement rate coming out of Medicaid, healthcare quality and compliance, or rather healthcare financing and policy. what I thought I just heard out of the Administrator of Aging and Disability Services was that she hoped that that $25 rate would also apply to the waivers. I really hope so, because the respite today is currently lower than the minimum wage that was approved last year. So having said that, it's hard enough to qualify for some of these programs. You really have to be low income, let alone qualify and not be able to get the service. So there's wonderful things in the budget, and I think it will go a long way to change what is going on in our state. Thank you.
Thank you very much. Seeing no more public comment here in Crescent City, we'll go to Las Vegas. Seeing no one in Las Vegas, we'll go to the phones. BPS, when you're ready, please go ahead.
Thank you, Chair. If you would like to offer public comment for today's meeting, please press *9 now to take your place in the queue. Once more, that is *9 now to take your place in the queue to offer public comment.
Hello, state legislators. Good afternoon. I want to thank the administrative services for operating the phone line and enabling me to speak. I would like to speak to the chair because I called in yesterday, and
would you please state your name? Would you please state your name for the record before you move on?
John Carlo, and I was misnamed, and someone else was misjudged yesterday when I called in. I'm not Cyrus. I'm John Carlo, aka Ghost.
Is your last name Carlo?
I'm talking about, yes. I'm calling about the opiates you guys were talking about today. I think that's kind of like, I'm kind of appalled that we're paying people to grow these heroin essentially and administer it into medicine. There's an old-fashioned farmer who helped men like that, and he fed them watermelon for a month or two. Watermelon. And basically, I think what we're doing is this. I think this is a state border issue, and we need to make sure we have state checkpoints, that there's no human trafficking, there's no drugs that are coming into our state at the border level. And also, I would like to see the Southern Nevada Health District have a report on the vaccine efficacy rates and adverse reactions. I begged, the phone lines do not work. The state health department will not give us, the citizens, a report on the vaccine in Nevada. So those are kind of my big concerns. And then the tobacco. Thank you guys very much.
Thank you very much. Next caller, please.
Good afternoon, everyone. My name is Cyrus Hojadi. Reason why I'm calling is I'd like to call on the whole legislature to show us proof the effectiveness of not only the lockdowns, the mandates, social distancing, but more importantly, the vaccine. This vaccine was promoted by many government agencies and officials throughout the state and many counties. We'd like to see the effectiveness, whether it worked or not. We'd like to see some data. We'd like to see some examples, comparison among other states and countries, countries like Sweden especially, which hardly did any of these restrictions. And we'd like to see whether or not all these efforts were worth it. Because there was a lot of changes that had to be made, a lot of livelihoods affected. We just want to see, was it worth it? Just have a meeting in the coming weeks and months, tell us whether this was effective, and we can basically make a decision that is reasonable and that is important. Thank you so much. I will yield my time. And I forgot, because right now we have significant high numbers of inflation. I just heard about that earlier. So the question is, would this inflation situation happen had these events of the last 3 years I just talked about had occurred? Yield my time.
Thank you very much. Next caller, please.
Thank you, Chair. The line is open and working. However, there are no other callers to offer public comment at this time.
Thank you very much. All right. Well, I would like to thank all of those again who participated in the meeting today. We'll be back again at it tomorrow morning at 8:30 to hear budget presentations from the Department of Education and the Nevada System of Higher Education. And so this meeting is adjourned.
Thank you, Madam Chair.